Hi everyone, it's Tammy Meeks, and I'm here to talk to you about my paper and discuss the two models of healthcare delivery that I chose to evaluate. First, a little bit of background on what we're talking about. Healthcare in the United States is a challenge. We continue to have rising healthcare costs that are disproportionate to our quality outcomes. We have higher healthcare costs than almost any other industrialized country, but we're in the lower third as far as outcomes go. And then we also have a healthcare system that is less accessible to a large number of the population. In 2010, the Patient Protection and Affordable Care Act was enacted, and part of that was to make healthcare available to most of the population by developing standards, regulations, and expectations. And the thought was also to make healthcare more affordable by setting certain regulations that employers had to abide by. What we found is that just because a large number of the population has health insurance, it doesn't necessarily mean they have access to health care, whether it be that they're in remote areas or they can't find a provider or whatnot. So not as much emphasis has been placed on health levels, outcomes, or wellness. So there's many theorists out there that believe in order to improve the accessibility, have quality outcomes, decrease costs, that we need to revamp the healthcare delivery systems. The two I picked to compare and contrast are accountable care organizations and nurse-managed health clinics. Briefly, accountable care organizations are a network that is developed to share medical and financial responsibility by establishing a primary care provider that collaborates with all healthcare disciplines in order to provide coordinated patient-centered care. And the way this works is it's a network between organizations, healthcare organizations like hospitals, and then providers. The primary care provider is the team leader and is basically the liaison between the specialty units and ancillary services. So it takes a lot of team coordination, but this prevents patients from having to go from one specialty provider to another if they have multiple chronic illnesses. And it can all be managed through one provider, or at least one provider can overlook the whole scope of care. And this can help decrease costs by eliminating unnecessary tests and procedures. Nurse-managed healthcare clinics, it's a little bit different, and this is where nurses have a bigger part in this type of model. It was partially funded by a grant from the ACA, and the main purpose is providing comprehensive care to individuals that are in underserved areas or vulnerable populations. The care is provided by an advanced nurse practitioner, which helps fill the gaps with the physician shortages we have. The problem is states have different laws that may or may not limit the scope of practice for nurse practitioners. So I'm going to speak more about the organization that I chose, or the model that I chose to be superior to the other, and I chose accountable care organizations. One of the goals of ACOs is to improve the quality of healthcare in the United States while at the same time decreasing costs. There are statutory requirements. They must be accountable for the overall care of the Medicare fee for service beneficiaries that are assigned to this ACO. They must define a process to promote evidence-based medicine and patient engagement, report on quality metrics and care coordination, and include the use of telehealth. So this is a way to reach the hard-to-get-to areas. And they also must maintain certain patient-centered criteria. The ACO's model of healthcare delivery relates to the nursing meta paradigm by offering a network of providers and healthcare organizations that collaborate the care of the person by working together as a team, managed by a team leader to holistically care for the patient. And it covers all 4 areas of the nursing meta paradigm: the person, the environment, nursing, and health. The theory that I chose that relates to ACO is Watson's human caring theory, which suggests that when human caring is applied in interprofessional teams, healthcare professionals find a caring consciousness to care for oneself, each other, and promote care. The quality aspect. There are multiple or a variety of benchmark tools that can be applied to accountable care organizations. There's initiatives or incentives outlined by the Centers for Medicare and Medicaid Services hospital incentives. There are also state and professional level benchmarking tools. In my state, there's a CanCare Quality Management Program. There's also a quality management program that is partnered by 2 different state organizations that provide guidelines that comply with the Code of Federal Regulations. And after researching and reviewing ACO, it appears that they align with most of the Institute of Medicine's 10 rules for redesign. Conclusion. Basically, there is evidence that supports the need for different healthcare delivery systems within the United States, which is evidenced by the continuing to have the increased healthcare cost and lower healthcare outcomes. There needs to be more of a focus on the patient at the center of care, holistic care involving the patient, the family, while also not only that as far as the environment, but branching out into the community and working as a team to collaboratively care for these patients. And a big part of that is preventative education and preventative medicine. And this can all be coordinated as a team with the primary care provider at the center of the team. This will also reduce a lot of the cost, and also it'll be better for continuity of care, with it just kind of like one person driving the bus kind of thing and then asking for help from a variety of people. And I see that in my organization. It's kind of scattered sometimes. We have an intensivist in the intensive care unit, but then we have all these specialty providers that come in, and there are times when they don't necessarily coordinate their care with each other. So one group will write a set of orders of maybe tests to do, and then they may get done or they may get discontinued by a different set of specialty providers that come in to see the patient. So there's just a lot of parts and pieces that don't always run smoothly. And with an ACO, you would have somebody that's kind of guiding the patient-centered care, but it would be the provider along with the patient that's guiding the care. So after looking at the different models that were addressed in the research, I felt like accountable care organizations came the closest to meeting the expectations that are mandated by the ACA, in addition to being the most equipped to provide quality, patient-centered care at a decreased cost. Regardless of the model chosen or the model used, there's still a lot of work that needs to be done, and the process will continue to evolve over time. But if it's just evident that we need to reform and come up with a better health delivery system in order to meet the mandates of the ACA, but just in general improve healthcare across the United States to a greater number of people. Thanks, and hope you guys are all ready for a little break, and hope you did well during this course.